Welcome to MedMastermind. Let's say about menopause today. Menopause is nothing but time of cessation of ovarian function resulting in permanent amenorrhea. Amenorrhea is absence of menstruation. So, the time of cessation of ovarian function resulting in permanent amenorrhea is called menopause. Usually, it takes 12 months to confirm the diagnosis of menopause. That is, there should be amenorrhea at least for 12 months. Climacteric is a phase which occurs 2 to 3 years before menopause too, and it continues even 2 to 5 years after menopause. The usual age of menopause is between 45 to 50 years, the mean age being 47 years. When the woman attains menopause in less than 40 years of age, it is called as premature menopause. But whereas the menopause is not attained even after 52 years, then it is called as late menopause. Coming on to the pathophysiology behind menopause. In the initial climacteric stages, the ovarian activity is reduced and there is no ovulation in cycles and there is no corpus luteum which is formed. Therefore, there is no progesterone. So, therefore, the cycles initially it is going to be anovulatory cycles. So, it is going to be anovulatory cycles before menopause. Now, in the later stages, the Graafian follicles also fail to develop and the estrogenic activity is even more reduced that it results in endometrial atrophy and amenorrhea sets in. So, therefore, there is no development of Graafian follicle and finally you have amenorrhea because of reduction in the estrogenic activity. So, fall in estrogen and inhibin will cause increase in the FSH and LH levels. Now, here you need to remember two important values. So, first one is FSH level. When it is going to be more than 40 international units per liter, it is diagnostic of menopause. And similarly, your estrogen level. So, when you talk about your serum estrogen level, so when it is going to be between 20 to 70 picograms per ml, yes, it is going to be safe. But when it is going to be less than 20 picograms per ml, then that woman is more likely to develop cardiovascular diseases and osteoporosis and all that. So, therefore, the estrogen level, it has to be between 20 to 70 so that the woman is safe. Now, coming on to anatomical changes, ovaries, they shrink. Muscle in the fallopian tube will undergo atrophy. Cilia in the tubular epithelium will disappear. Uterus becomes smaller. Functional layer of endometrium also disappears. So, only the basal layer remains intact. Genital organs also undergo atrophy. Vagina, it becomes pale, thin and dry. And they are more prone to develop senile vaginitis. Now coming on to breast. So in the breast usually the glandular tissue will reduce. So the glandular tissue in the breast is going to reduce but the fat is going to increase. So therefore the breast in these women will be pendulous. So coming on to the symptoms of menopause, 60 to 70% of the time women who is attaining menopause will not have any problems. But others can face problems like their early symptoms will be hot flushes. In hot flushes, there is going to be vasodilation of face and neck. So, there will be vasodilation of face and neck. And this will be lasting for around 2 to 5 minutes. And this will be followed by sweating. So, why there is vasodilation and why there is sweating? So, basically you can have increase in the noradrenaline levels, so which will increase the heat loss mechanism to act. So, therefore, there can be vasodilation initially followed by sweating. So, this sweating is more prominent at night, so therefore, it is night sweats. Because of this sweating, they can have sleep disturbances. Because of sleep disturbances, they can have headache, palpitations, irritability and lack of concentration. Now, intermediate symptoms can be loss of libido and there can be dysuria, stress incontinence and urge and recurrent urinary tract infections. So, they can have stress incontinence because of poor vascularity. and also because of the poor tone of internal urethric sphincter. So these urethral symptoms together are called as urethral syndrome. It is called as urethral syndrome. Now coming on to the late symptoms. What are the late symptoms? They can develop osteoporosis. So osteoporosis is where the bone mass is going to be reduced. So there will be reduction in the bone mass. Now next you can have backache and you can have cardiovascular diseases. Why there is cardiovascular diseases? Normally your estrogen, basically it is going to increase HDL level and it reduces LDL, cholesterol and triglycerides. But when there are no estrogen, this is going to reverse. There is going to be reduction in HDL, there is going to be increase in LDL, cholesterol and triglycerides. So therefore they are more prone to develop cardiovascular diseases like atherosclerosis, ischemic heart disease, etc. They can also have cerebrovascular accidents like stroke. Coming on to skin, so what happens in skin is the collagen content will be reduced. So because of reduced collagen, they can have wrinkles. What are the investigations that have to be done in this women? So the investigations, the basic investigations, like you have to take the history, general examination, vital signs have to be checked, pelvic examination along with pap smear, blood glucose levels, lipid profile and ECG have to be taken, mammography have to be done, pelvic ultrasound to assess for the endometrial thickness, to assess for the ovary size, and DEXA, it is mainly for the bone scan. So this will help you to tell you the bone mass. So therefore you have to go for DEXA. So DEXA is nothing but dual energy X-ray absorptiometry. So this can tell you the bone mass. And you have to check for the estrogen and FSH levels, endometrial biopsy. Management of menopause. Hot flushes can be treated with drugs like clonidine and hormone replacement therapy. So now we are going to discuss about hormonal replacement therapy in detail. Hormonal replacement therapy can be given for therapeutic uses and it can also be given for prophylactic uses. So who will receive prophylactic HRT is women who is at risk of developing cardiovascular disease or osteoporosis, stroke. So they can be given with prophylactic hormonal replacement therapy. So women with symptoms or who is developing osteoporosis, so all of them can be given with the therapeutic hormonal replacement therapy. Now coming on to this hormonal replacement therapy, this can be given for short term and it can be given for long term. So when we talk about short term, it is given for a duration of 3 to 6 months. But long term, it is not exceeded 8 to 10 years. So you can give to a maximum of 10 years, not beyond that. So what are the forms in which you can give short term hormonal replacement therapy? So you can give as oral tablets. There are creams which are available, vaginal creams available, estrogen creams available, and there can be usage of vaginal rings. Right. Now of these three, when we talk about oral, when we give oral estrogen, the women can develop endometrial hyperplasia and later on she can develop even endometrial carcinoma. So therefore, it is better to give progesterone in these people. So these progesterone should be given at least for 10 to 12 days every month so that the endometrial hyperplasia comes down. So therefore progesterone can be given for 10 to 12 days per month. This progesterone is not given if the woman has undergone hysterectomy. So in hysterectomized women, you don't have to give progesterone. You have to give only estrogen for them. Now coming on to the long-term treatment with hormones. So the long-term treatment, again, it can be with oral estrogens and progesterones, or it can be with your creams, it can be with transdermal patches, and it can be with vaginal rings as well, or implants. So this is how you give the long-term treatment with. Apart from the hormonal replacement therapy uses, what are the contraindications to this hormonal replacement therapy? So when the woman has got a family history of carcinoma, you cannot give. And for a woman with breast cancer or endometrial cancer, you cannot give. And next, if they have got a previous history of any thromboembolic diseases, then for them also you should not give hormonal replacement therapy. Women with liver or gallbladder disease, they should also not receive this hormonal replacement therapy. Apart from these drugs, what are the other drugs that can be given? So you have drugs like tibolone. So this can be used for osteoporosis and also for treating hot flushes and all that can be improved with this drug called tibolone. So this tibolone is nothing but a 19-testosterone derivative. So you can give tibolone. Now the next drug you can give is raloxifene. So what is raloxifene? It is a selective estrogen receptor modulator. Now what this drug does is it improves the bone mass. So it is helpful in osteoporosis. Apart from that, with respect to lipid profile, it increases HDL level and also reduces your LDL level. So therefore this can be given to combat this lipid profile discrepancies also. Now coming on to soya, so whoever cannot tolerate estrogen, so they can take this soya in their diet. Because 11 gram of soya is going to have 2 to 4 milligrams of estrogen. So this phytoestrogens also helps in increasing your HDL and it also reduces LDL, cholesterol and also your triglycerides. LDL, cholesterol and triglycerides. So therefore it is helpful. Other drugs are your bisphosphonates. So when we talk about bisphosphonates, this is very helpful for your osteoporosis. Why? Because it is going to inhibit your osteoclastic activity. You know osteoclasts are the one which is going to cause bone resorption. So therefore this is going to reduce the osteoclastic activity. So therefore the bone resorption is reduced. So this reduces the bone resorption. So in this you have many drugs like etidronate. You have drugs like etidronate. This can be given at a dose of 400 milligrams daily. This has to be given for 2 weeks and then you give a 2 to 3 months break, and like this you have to continue for 10 cycles. Alendronate at a dose of 5 milligrams per day or 35 milligrams per week can also be given, and this has got less side effects when compared with other bisphosphonates. This completes the discussion on menopause. Thank you.